ang sakit na bumabagabag sa atin. Ang panlaban, lakas ng katawan. Pag mahina ang katawan, madaling magkasakit. Kailangan ng tamang pahinga, pagkain, ehersisyo, konsulta sa doktor. Inumin ng vitamins at maintenance medicines para kung tablan, kayang lagpasan. Kaya huwag magpanik, magpalakas. Lakas ng katawan ang panlaban. Paalala mula sa tamang alaga ng RiteMED.
Ayan. So magandang umaga po sa inyong lahat na nakatutok ngayon sa Tuesdays with RiteMED. Ako nga pala si Kaiser Estrada, ang inyong host para sa episode na ito. Ang Tuesdays with RiteMED ay isang programa na inilunsad ng RiteMED upang magbigay ng importanteng kaalaman tungkol sa pangkalusugan na maaari ninyong magamit sa pang-araw-araw na buhay. Pananakit ng dibdib at pakiramdam na para bang nasusuka ay ilan lamang sa sintomas ng Gastroesophageal Reflux Disease or GERD na maaaring maging sanhi ng pagkasugat at pagdudugo ng inyong lalamunan. So samahan natin si Dr. Angelo B. Lozada, isang Digestive and Liver Disease Specialist sa isa na namang makabuluhang episode ng Tuesdays with RiteMED. So magandang umaga, Dr. Jello, at welcome sa ating programa.
Good morning, Kaiser, and welcome dun sa mga taga-subaybay ng Tuesdays with RiteMED. So I'm very happy to be with you and everyone here today.
Yes, so ayan, magandang umaga. Meron tayong mga manonood mula sa DepEd Albay. We also have other viewers from other parts of the country actually, Doc. So ngayon, pag-uusapan natin ay gastroesophageal reflux disease. This is, mahirap siyang bigkasin as a disease, no? So siguro I'll let you handle the explanation kung ano ba to. Pero before we start siguro, isa sa pagkakaalam ko regarding GERD, is this the same as acid reflux as well in layman's term? O ito ba ay isang mas malalang kaso ng acid reflux? Tama ba yung pagkakaintindi ko, Doc?
Yeah. Well, Kaiser, you're partly correct. No? When we say GERD, no, this is acid related. No, so yung acid reflux, no, it's parang layman's term, no, that we say na what is GERD, no. So pagka sinabi nating acid reflux and GERD, they are synonymous to each other.
All right. So sige, I'll let you discuss about gastroesophageal reflux at malalaman natin siguro by the end of the presentation kung paano ba natin madedetermine ano yung signs and symptoms ito and how can we actually treat this. All right. Go ahead, Doc.
All right. Thank you, Kaiser. So magandang araw po sa inyong lahat sa mga taga-subaybay ng Tuesdays with RiteMED. So I'll be discussing about GERD or gastroesophageal reflux disease, no. Very common ito, no? Siguro at one point or the other, no? Some of you or most of you would have probably experienced these symptoms, no? You would have like chest pain, may parang burning sensation sa throat or feeling may lump sa throat, or parang nangangasim yung tiyan, no? Parang mahapdi sa may sikmura. So these are very common complaints, no? That we see na from time to time, no, especially those who would have acid-related diseases. No? So, at one point or the other, lahat tayo naka-experience na ng mga ganitong klaseng symptoms. So, what is GERD? No? So, GERD is called gastroesophageal reflux disease. So, this is when yung gastric juices in the stomach goes back up. No? It refluxes back up into the esophagus, and yung limit, no, it exceeds the limit of acid, no, because ang nangyayari is pumabalik yung acid paakyat into esophagus, no. Iba kasi yung lining ng stomach natin sa lining ng esophagus, no. So yung lining ng esophagus, no, hindi siya, it cannot handle acid unlike our stomach. So that's why we have these symptoms of like chest pain, yung reflux, burning sensation in the throat, no. Sometimes even difficulty of breathing. There are other times that we would have like what we call silent GERD, no? And because this acid goes back up into the esophagus, it causes damage, no? So may tayong tinatawag na caustic injury. And sometimes you can actually have no symptoms at all, no? You can be having a type of silent reflux or silent GERD. So the prevalence of gastroesophageal reflux disease is actually increasing. No, we note that in Asia, no, in 2010, there's almost a double, no, in the prevalence of GERD, no. So around 6 to 10%. Paano pa ngayon na 2020, no? In fact, this time of the pandemic, no, last year 2020, when I started my online consultations, no, I would see a lot of patients who would be experiencing these symptoms, no, and there are a variety of factors, and then I'll discuss with you later, no. One of them is actually stress, no, which can cause GERD, but I'll get into that later. So, ano ba yung mga signs and symptoms nitong GERD? What are usually what one would feel? And number one would be heartburn. No, you have a sensation of a burning sensation in the throat or in the chest area, and that's what we commonly known as heartburn. Another would be regurgitation, yung parang feeling nyo bumabalik yung pagkain. No? Minsan, nalalasahan nyo pa yung pagkain na kinain nyo during lunch or dinner, and that is what we call regurgitation. Sometimes, we would also experience bloatedness when you have the feeling of fullness in your abdomen, feeling nyo gassy, feeling nyo mahangin. You would have sensations of always burping. May mga symptoms din na always passing gas or always farting, no? Yan. So that's one symptom that one can feel, no? Another is also upper abdominal pain, no? Particularly in the epigastric area, no? So yung sa may ilalim ng sa ilalim ng ribs, no? Right in the middle, no? You would have some epigastric pain. And another symptom would be sometimes nahihirapan lumunok, no? You would have difficulty of swallowing, or tinatawag na dysphagia. And commonly, people who have GERD would have that sensation of lump in the throat. No? Parang feeling nila may bola dito sa neck area nila. So, usually that would also be a symptom of GERD. No? So, sometimes we get patients na are referred or come to us because they've already did examinations in the neck, feeling nila may bara or may bukol, but they come out negative, but they still have that sensation of a lump in the throat. So that could be GERD. No? That could be a symptom of GERD. So there are also what we call atypical symptoms, yung hindi masyadong napapansin or that will not actually commonly associate with GERD. No? Sometimes those who have chronic GERD or have chronic reflux would have yung mga dental problems, no? May dental erosion, nasisira, may pagkakasira ng ngipin. Also at times, no, people who have yung tinatawag nating halitosis or bad breath might have actually GERD, no? So it's coming from hindi lang siya sa oral cavity, no, but it's coming deeper, no? It's coming from the stomach and the esophagus, no? Sometimes yun yung reason kung bakit may halitosis or bad breath. Frequent hoarseness of the voice and frequent sore throat can also be attributed to GERD, no? Because the acid is caustic, no? Nakakasunog siya, no? Yung acid na galing sa stomach. So it can cause hoarseness and sore throat na common. Another is ear infection or tinatawag na otitis media, no? So our pharyngeal area, yung mouth area natin, is actually connected to our inner ear, no? So there's a connection in there. And sometimes yung pagre-reflux ng acid, pwede umakyat, no? Hanggang sa middle ear natin. So meron tayong tinatawag na condition such as otitis media or pamamaga ng middle ear. And also yung frequent coughing or wheezing, especially na nag-GERD tuloy ako. Excuse me. Especially coughing or wheezing na tinatawag natin yung pag-uubo ba. And it's very frequent, no? Sometimes, i-refer sa amin ng pulmonologist kasi they've given all of the medicines for cough, antihistamines, anti-allergy medications, but it's actually not an allergy, but actually something that is related to GERD, no, na nagkakos ng chronic cough. Okay, ano ba yung complications? What can happen when you have GERD, no? So again, when the main physiology of GERD is actually merong looseness, no? Medyo maluwag kasi yung sphincter, no? So between the esophagus, between the esophagus and the stomach, meron tayong tinatawag na lower esophageal sphincter. So nakikita nyo po dun sa images natin, and it's a muscle, it's a circular muscle that contracts, no? So pag merong pagluluwag ng lower esophageal sphincter, no, it becomes incompetent. Yon, the acid is able to go back up into the esophagus, no? So one complication is yung nagkakaroon ng erosions, no? So on the right side of the image, you will be able to see yung letter B, yung erosions, no? So that's an image side by side. When we do an endoscopy, yan po yung image, no? Yung letter A, that is a normal esophagus, no? Compared to letter B on the right side of the image is makikita nyo may mga erosions, may pamumula, no? Kasi because of the chronic acid na bumabalik back up. And yun, so nasisira yung lining ng esophagus, yung lower part ng esophagus. And syempre, there's chronic inflammation. And of course, when there's chronic inflammation, this leads to yung tinatawag nating erosive esophagitis. And syempre, when there's frequent damage to the lining of the cells, no, nagkakaroon kasi ng transformation. So nagkakaroon ng abnormality dun sa mga cells, no. So we can have actually what we call Barrett's esophagus. No, I'm sure narinig nyo na po yung Barrett's esophagus because our president actually has been parang na-diagnose with that particular condition. But this is actually what you call a precancerous state, no? Hindi naman siya cancer. But of course, if not monitored and not looked into deeply, one may develop what we call adenocarcinoma of the esophagus, no? Yung cancer na tinatawag, no? So ito, yung makikita nyo on the image on the right side, which is yung letter B, yan, may formation na ng mass, no? So you can develop a mass or what we call esophageal cancer, no? Pero wag po kayong matakot, no? Karamihan po ng mga viewers, no, karamihan ng mga nagko-consulta, nagtatanong, Doc, meron na ba akong cancer or magkakaroon ba ako ng cancer? No, it takes time, no? It takes time actually before these things develop. Pero when you have these chronic symptoms, it's better to get it evaluated para naman ma-check natin kung meron ng mga tinatawag na transformation, no? Kung merong malignant transformation nung lining ng ating esophagus. Okay. So what can you do? No, so ito yung mga treatment strategies, no. So syempre, apart from medications, we'll focus first on what you can do as an individual to manage your GERD, no. Number one is syempre weight loss, no. So yan yung mga diet and exercise na tinatawag natin, no. So if you manage your weight, no, if you try to lose weight and decrease your abdominal obesity, kumbaga, no? Kasi yung pag malaki ang tiyan, it causes pressure in the abdomen, no? And then syempre mas madali mag-reflux back yung acid, no? Because of the increased abdominal pressure. Another thing is to avoid certain types of foods na nagtitrigger ng hyperacidity and GERD, no? Yung pagkakaroon ng reflux. Number one is yung alcohol intake. Usually mga tomatoes, soda, citrus, chocolates, coffee. Those are some of the things that can trigger, no, excessive hyperacidity as well as GERD, no. Yung pagtulog ng when you sleep agad, no, when you lie down after eating, no. So yung mga mahilig kumain ng dinner tapos tulog agad, yon. They're very prone to developing GERD, no, because essentially marami pang contents yung stomach, so it can reflux back up. Another thing that you can do is avoid overeating, no. So if you try to eat as little lang, no, not as much, no, to the point na hindi yung sobrang busog, then that would be fine, no. A little story that I would like to share is that a friend of mine actually told me na yung mga Japanese daw when they eat when they actually feel mga 80% full, they stop eating already, no, parang ganyan, no. siguro that's a good practice, no? When you feel parang hindi ka pa masyadong busog, no? But then you should stop eating, and especially those who suffer GERD, no?
Okay. So,
Another,
I
yeah.
have a question, no? Kasi I know of some people na hereditary yung kanilang condition. For example, namana nila sa parents nila, parents of their parents, parang line of their family, they really have the tendency to have acid reflux or GERD. Pero would you rather say it's more of a lifestyle case rather than hereditary? From most cases, dun siguro sa na-experience yung nagpapakonsult sa inyo or mga patients na na-encounter nyo, more of lifestyle ba siya na nakukos as a disease or more of hereditary po ba siya?
Yeah, that's a good question, Kaiser, no? Because siguro, as I would say, no, 80 to 90% of the time, it's a lifestyle disease, no? So it's really related to the type of food that you eat. And it's also the tolerance, no? I mean, some people can actually tolerate these certain foodstuffs, no? These certain food materials. For example, may taong makakatolerate ng 5 to 6 cups of coffee. Samantalang one person, I mean, if it takes only 1 cup of coffee, magkakaroon siya ng extreme hyperacidity and GERD, no? So also depends on the tolerance. Siguro doon na natin masasabi na it's hereditary or it's inborn, no? Na you as a person talagang hyperacidic ka, you cannot tolerate as much of these certain food materials, no? So yung mga ganyan. So in a way, a big factor is lifestyle and also siguro your own body, no? It depends on your tolerance to these certain food items. Pero hindi lahat kasi ng tao, may mga tao na parang pag nag-soft drink sila, okay naman sila. They don't have hyperacidity or reflux. May mga tao naman na they get hyperacidity or reflux with tomatoes, yung iba hindi. So it's also a case-to-case basis.
Okay.
Yeah. Yan. Another thing is that you should avoid smoking, no? Kasi yung smoking has a effect on your lower esophageal sphincter, no? Yung sphincter lumuluwag yan. And kaya yun yung nakaka-cause ng pwedeng magkaroon ng reflux. Another thing also that I would advise or your viewers is to avoid, kunyari bending down too much, no? So pagka marami kang nakain, no? Tapos busog ka, yung pagbe-bend down, yan. So sometimes it increases kasi the abdominal pressure, no? So talagang napipiga yung stomach mo, and then it can cause more reflux of acid back up.
Okay. So importante po pala talaga yung dieting. Now, hindi ko alam, actually this is the first time that I knew of kung sakali for example, dahil sa overconsumption natin ng pagkain at paglaki ng ating stomach, no, maaaring ma-push. At because of that, mas malaki yung tendency na umakyat ulit yung acid back up to our esophagus. No, so okay, that's really good knowledge for us this morning na kailangan talaga nating ingatan at kailangan nating pag-isipan ng mabuti yung ating lifestyle and what we actually consume. All right, go ahead, Doc.
Yes, okay. So this is just a summary of what I've actually mentioned kanina, no? So lose weight, avoid certain food products, no? Avoid yung mga coffee, onions. You eat in small amounts. You can do frequent meals, larger than large meals, yung mga buffet, ganyan. So bawal yung mga dapat iwasan ng mga nag-GERD yung pagbo-buffet. And then syempre you wait a few hours before lying down. Another technique is you can elevate the foot of your bed a few inches up, no? Lalo na pag medyo common kasi yung GERD kasi sa gabi, no? So most patients would have more of these symptoms in the evening, mga nighttime symptoms. So this is a technique that you can do, and yun nga, avoid bending and stooping positions. So for example, no, you've already instituted all of these lifestyle modifications, but still you would have symptoms, no? So it's time to seek help, or time to seek better strategies on managing your GERD and your hyperacidity. Your doctor may prescribe actually a few things, no? So we can start off with mga H2 receptor antagonists, no? Yung commonly known as ranitidine or famotidine. Those are the generic H2 antagonists, no? They work very quickly, but they're not. You can't use them on the long term. Another is yung mga antacids natin, no? Yung mga magnesium hydroxide. What else? What you can have your sodium alginate. No, these are your common antacids that you can use. And then you can buy also over the counter. Your doctor may actually prescribe something more stronger, yung mga proton pump inhibitors, no? So I'm sure some of you would be familiar dun sa mga proton pump inhibitors natin. They're commonly known as yung mga omeprazole, pantoprazole, lansoprazole, no? So these are the generic formulations, no? Anything ending with that azole na tinatawag, no? These are what you call your proton pump inhibitors. They're stronger anti-acid medications. They work longer, and it depends on your doctor how long he or she will prescribe it. So sometimes, no, if you will seek a specialist, no, you'll seek a gastroenterologist. Your gastroenterologist may actually recommend doing an upper endoscopy, no. So these are some of the this is the machine that we use, no. You can see the endoscope, no. It's basically a camera and a tube, no, with the light and camera at the end, no. And we look through the stomach, no. We enter the mouth and we look real time, no. And then we inspect yung lining ng esophagus, we inspect also yung lining ng stomach, and then we're able to see kung may mga ulcers, no. So common yan, tinatanong ng mga patients, "Doc, may ulcer na ba ako?" No. So we actually would say ang isang tao may ulcer pagka nakita po natin siya, no, visually, no. So it's very difficult to diagnose a person with ulcer just by consultation unless magagawa po tayo ng endoscopy. Also, during endoscopy, we can check for other things, no? Kung merong infection or merong mass, may bukol, no? So yun yung sinasabi nating surveillance, or merong mga precancerous lesions inside the upper gastrointestinal tract. So I think this will be my last slide. So if we'll give time for questions. I'm sure, Sir Kaiser, maraming mga questions yung mga viewers nyo, no?
Correct.
So yeah, so that will be the end of the lecture, no? So thank you.
All right. So siguro ito, Doc, no, before we proceed muna with the question and answer portion, I have a personal question with regards to endoscopy, no. So sa endoscopy ba, ito ay isang procedure na ginagawa para malaman if a patient would actually have GERD, or nagde-develop na ba ng GERD or other, chronic diseases pa?
Yeah, that's a very good question, Kaiser, no? Actually, we can actually diagnose a person to have GERD just based on the symptoms. So, pag ang isang tao would experience the symptoms of reflux, no, chronic reflux, and would have all of these symptoms that we've mentioned before, no, yung lump in the throat, chest heaviness, chest pain, difficulty of breathing, then we can actually diagnose a person to have GERD, no. When we do an endoscopy, we'll be able to see kung merong mga physical manifestations or meron na bang naging damage yung pagkakaroon ng tao ng isang GERD, no. So mas makakatulong then para malaman natin kung meron na bang mas serious na nangyayari when we do an endoscopy. And this will depend on the recommendation of your physician, specifically your gastroenterologist, kasi yung gastroenterologist po ang gumagawa ng endoscopy.
All right. So ito, Doc, first question mula kay JB Belisario. According to him, sino po ang mas madalas magkaroon ng GERD? Bata o matanda?
Ayan. Mas madalas actually sa tingin ko sa mga matatanda, no, yung nagkakaroon ng GERD, no. But actually children are not spared, no, from having acid peptic disease, no. So it depends, no. I'm an adult gastroenterologist. Meron din po tayong tinatawag na pediatric gastroenterologist. So they also specialize in gastrointestinal diseases in children because sometimes iba kasi yung mga manifestation sa bata.
Alright. Ito naman ay mula kay Janine Idquival. Can stress and anxiety cause GERD or is it the other way around? Or may direct correlation ba ang stress and anxiety sa GERD?
Yes, Janine, that's a very good question, no? In fact, no, this time of the pandemic, especially last year, no, I think maraming nakaka-experience ng GERD, no, because of anxiety and stress, no. So anxiety and stress can actually precipitate excessive acid production, no. And because of this excessive acid production, nagkakaroon ng mga symptoms of GERD and reflux. So yes, that is correct. Stress and anxiety can cause GERD.
Okay. So lifestyle nga talaga siya, hindi lang necessarily like food you intake but also like how you live your life. It can affect or nakakapagdulot din ito ng GERD itself. Okay.
Yes.
Marami akong natututunan ngayong umaga, Doc Jello. So ito naman isang katanungan mula kay Reynold Sevilla Paglinawan. Sabi niya, ano po ang worst na maaaring maidulot ng GERD?
Ayun. So when we have chronic GERD, no, as I've mentioned earlier, no, maaaring magkaroon ng damage, no, ng damage to the esophagus. So nagkakaroon ng physical transformation, no. So yung pagkakaroon ng Barrett's esophagus, which is a pre-cancerous state, no, na parang you're one step closer to developing cancer, no. So esophageal cancer yung worst na pwedeng maidulot ng pagkakaroon ng GERD, no.
All right. Ito, Dr. Jello, no? Kasi we're also cross-posted as of the moment. No? So magandang umaga sa lahat ng mga nanonood ngayon ng live sa GMA News and also sa GMA Brand Talk. There's a question from GMA News na manonood natin ngayong umaga. Ito ay mula kay Ana T. Versosa. Sabi niya, nakapag-endoscopy na po ako, pero malinis ang walls ng stomach ko. Pink pa rin siya, pero constant yung heartburn ko. No medicine can alleviate it. Half day ako nasusuka and I can't eat anything. So whole day akong natutulog kasi wala akong kain. Ano kaya yung maaaring cause nito, Doc? And paano kaya siya matutulungan with her condition right now?
Nako, Ana. Meron ding ibang mga conditions that can cause chronic hyperacidity like an infection, no? Hindi ko na-mention kanina. A person may have H. pylori or Helicobacter pylori. That's a bacterial infection that chronically infects the stomach, no, that can cause chronic hyperacidity. So mabuting siguro ma-check, no, ma-reevaluate if you may have this particular condition. Baka meron, no, kaya hindi mawala-wala, and it depends, no. Minsan kailangan lang din maghanap ng tamang gamot or yung babagay na gamot sa'yo na pwedeng maka-alleviate ng symptoms mo.
Alright, later for Miss Ana, mamaya sasabihin natin kung saan pwedeng magpakonsulta kay Doc Jello. Maaaring siya po yung makapag-alleviate ng current condition ninyo. Now, we have one more question as well from Oiram Playak. Sabi niya, hi Doc, please advise. I'm suffering from severe acid reflux too. Hirap ako huminga, lalo na pag may mga lakad ako. Then I'm taking omeprazole, yung sinabi niyo po kanina, na 40 mg. Pag inatake pa siya, I'll add one more capsule of 20 mg. It takes almost an hour to effect. May side effects ba, Doc, ang overdosage nung omeprazole?
Alright. Yung tinatawag nating side effects ng omeprazole or yung mga PPI, they're generally safe, no? There's generally safe medications. Of course, yung mga tinatawag nating mga side effects or mga complications, we usually see them in those who have chronic intake, yung kunyari mga years ng umiinom ng certain medications na ganito. But I'm just a bit concerned, no, if you're taking a lot of,
40 mg
a lot of you're taking these medications. Baka sometimes, medicines have a certain limit, no, parang even if dagdagan mo pa ng dagdagan, hindi na siya mag-e-effect. There might be a better medication that is suitable for you, or your doctor may add on other medications to help with your symptoms. So it's best talaga to seek consult, no, and then to talk to your doctor talaga. So he or she will be able to help you with regards to what is probably needed or what can be added.
Correct. So ayan, isang key takeaway, no, para sa lahat ng 1.3 thousand viewers, live viewers for this morning. Ang isang key takeaway ko sa lahat ng natutunan ko sa lahat ng doktor na naging guest speaker natin dito sa Tuesdays with RiteMED ay huwag mag-self-medicate. Talagang kumonsulta sa inyong doktor kung anong proper treatment for you. So always consult the experts. Don't self-medicate at huwag mag-google ng kung ano-anong treatment para sa sarili nyo. Dahil ayon nga sabi nila ay iba-iba yung treatment na ginagawa para sa iba't ibang klase ng tao. So wala talagang one size fits all na treatment. So better consult the experts and consult your doctors. So eto, meron tayong katanungan. I think this is also a valid question. Mula kay Mon Fernandez. Sabi niya, Doc, please acknowledge my question. Yes, ayan, ina-acknowledge na po natin. What can you say to those people who are giving advice that apple cider vinegar can neutralize the acid in the stomach? Tama po ba ito?
Well, logically speaking, no, apple cider, no, is vinegar, no, it's acid, no. So your stomach actually produces acid already, no. So you're adding more acid to acid, no. So what does that mean, no? So it will not neutralize acid, no. It will actually just add more acid to your stomach. So yeah. So I really don't advocate apple cider. But it depends, no. Some people they feel better with it, no. But if it does make you feel better, then it's okay, no. It's apple cider naman is not a chemical. It's not something that is actually harmful, no. So it's still food. But personally, I would not subscribe to it, no. But if it makes you feel better, if you have symptoms, if it alleviates your symptoms, then it's fine, no. The worst thing that could happen is nothing, actually.
All right. Eto, may question tayo mula kay Betty Kang. I think this is a very short question but very valid question as well. May OTC po ba ang GERD or for GERD?
Ayan, mga over-the-counter medications. Usually, mga antacids po natin, no? Yun po yung mga over-the-counter medications natin, no? So yung mga magnesium hydroxide, aluminum hydroxide preparations, yung ating mga sodium alginate preparations, ito po yung mga ating over-the-counter medications for GERD. They are temporary, they provide temporary relief, but hindi sila matagalan.
If chronic na siya, better to really consult na yung mga eksperto natin. At huwag mag-alala.
Meron nag-GERD lang paminsan-minsan eh.
Correct. At huwag mag-alala, may omeprazole ang RiteMED para sa may GERD. Pero mabuting magpakonsulta sa doktor para alam niyo yung tamang treatment at tamang dosage ng medisina na para sa inyo. Ito naman, meron tayong katanungan mula kay Lourdes Meryl Espada. How about turmeric tea, Doc? Is it okay? I felt relieved every time I drink tea. So we assume meron siyang condition currently na GERD. So every time daw na umiinom siya ng turmeric tea, nare-relieve daw yung kanyang symptoms. Is it also an alternative of some sort?
Actually, this has been a very common question, no? So we try to look into the evidence, no, about turmeric and its effect in the gut, no? So turmeric has a lot of good effects or good benefits in the gut, no? So one of them is also helping in alleviating hyperacidity and GERD, no? So ang turmeric meron siyang herbal properties meron siyang tinatawag na medicinal properties which may alleviate symptoms. So tama po yan, turmeric can be helpful, no? Some certain foods can be helpful and turmeric is one of them.
Okay. Eto naman, isang katanungan mula kay Francis Alcantara. Nakakatulong po bang mag-fasting kung may GERD?
Okay, so logically, no, when you have acid reflux, no, syempre, if you have a lot of contents in your stomach, no, pagka punong-puno ka or busog na busog ka, the tendency to have GERD is greater, no. So talagang I wouldn't really advise. I mean, you can still eat, no. You don't have to fast. You can still eat. You can eat in moderation in small amounts, and that would be fine.
All right. So ito, Doc, we have an influx of questions, all of the platforms currently, pero I'll read the final question for this morning. If in any case may other katanungan pa po yung ating mga manonood, mas magandang magpakonsulta na lang tayo kay Dr. Jello. Later on, we'll know where we can get a consultation from him. Ang last question natin for this morning ay mula kay Arthie Cueno. Ayon sa kanya, may mga gamot po ba na pwedeng magpalala ng GERD?
Yes, marami. Marami actually gamot na can cause hyperacidity, no, or can actually aggravate hyperacidity and reflux. So maraming gamot talaga. So it's important also, no, the takeaway here is that before you take your medications, no, for example, you see, kunyari, especially those who maraming doctors, no, when they see a lot of doctors, it's important to look for, it's important to check with your doctor yung mga tinatawag nating effects, no, cross effects between medications, no, because some medications may actually have effects, and then kailangan talaga naka-harmonize yung pag-inom ng lahat ng gamot. So pag maraming gamot, especially, kailangan talagang binabantayan yung mga iniinom. So yan. So it's important to be able to be vigilant.
Okay. Key takeaway again, laging kumonsulta sa expert dahil sila yung nakakaalam kung ano yung mga dapat na gamot na inumin natin. So I think that would be the last question for today, Dr. Jello. No? So any last message para sa ating manonood ngayong umaga? So we reached about more than 2,000 live viewers for this morning. So meron po ba tayong mensahe para sa kanila regarding GERD, kung paano ba sila matutulungan? At finally, no, you can actually let the audience know as well kung saan pwedeng magpakonsulta sa inyo, kung may telemedicine po ba na maaari kayong makausap, at any channels that they can actually seek consult to you, Dr. Jello.
Okay. So I just like to say na marami talagang tinatawag na silent sufferers. No, there are a lot of people who silently suffer from GERD and hyperacidity. So wag niyo pong tiisin, no? Marami diyan mga taon na nagkakaroon ng mga sintomas. So just seek help, just seek consult, no? You can see a specialist, a gastroenterologist will be able to help you. Sometimes your primary care physician will be able to help you. But when things become worse, just seek help and seek consult, because nowadays it's actually easier to reach a doctor, no? Kahit malayo ka man, nasa ibang probinsya ka man, or nasa ibang party ka ng Pilipinas, meron kang pwedeng makausap na doktor, no? And then dun sa mga gustong who would like to reach out to me, you can reach out to me through my Facebook page. It's at AB Lozada MD, AB Lozada MD at Facebook.
All right. So maraming salamat, Dr. Jello, sa sama sa amin ngayong umaga. Marami kaming natutunan. So next week naman, abangan ang next topic para sa Tuesdays with RiteMED. Tungkol naman ito sa toxic fumes, the dangers of chemical inhalation, upang magkaroon tayo ng kaalaman tungkol sa dangers of inhaling other dangerous chemicals katulad ng ammonia, kasama si Dr. Percy Punzal. So see you next Tuesday at 10 a.m. at magandang umaga sa inyong lahat.